Time now for this week's Health Matters with PA at Large in our community, Lynn Szabo. How you doing today, Lynn?
I'm doing great.
Let me have you get closer to that microphone for me, if you would.
Can I get the mic closer to me?
You can do either way.
That
Yeah,
work?
it all works like that.
Okay.
That's great. So I am just saying, hey, how y'all doing? I'm backing out. You've got something to. We'll begin with a segment with Mike here, because you guys have been following what's going on with healthcare in the jail. Right?
Yeah, and the juvenile hall.
Yeah, county jail.
So now you sub, you go in and you do work occasionally in these facilities,
I
right?
work for Turtle Medicine, and I'm kind of the fill-in person.
Gotcha.
So.
Okay. All right.
And Turtle Medicine, of course, was the entity that had the contract for providing medical services in the jail and the juvenile hall.
Right, for 20 years.
For 20 years, and now that's changed.
It's changing as of September 1st.
Right. The Del Norte County Board of Supervisors, to the best of my knowledge, probably has already voted whether or not to approve a new contract with an organization called California Forensic Medical Group, which is actually part of another bigger corporation known as WellPath. And the contract, as I understand it, is for $103 million, which is double what
No. It was $1.3 million.
Oh, $1 million. I'm sorry.
For a year. I was going, wow, we've got that kind of money?
No, I'm sorry. I misspoke. Thank you for correcting me. I totally,
Fake news.
I totally misspoke. $1.3 million, which is double what Turtle Medicine was getting. Is that about right?
Right. So foundationally, I should start by speaking a little bit to Turtle Medicine. So Turtle Medicine is kind of people that are known to the community for a long time and still actively providing medicine. So the owner of Turtle Medicine is Howard Croy and Kalani Baker, who brought you the walk-in clinic at Sutter when it was more functional, and also worked up at Curry. And then the other people that work there, besides myself, are Dustin Jaco, who works at Del Norte Community Health Center, Kim Hanks, who works up at Curry Walk-In, and a couple of nurses, Mary Hull, who is an RN that's been working for him, Ashley Rhodes, and I'm going to forget Randy's last name, Tomasini. Okay.
But, oh wow. Okay. And you guys are basically, are you contractors then for Turtle, or are you our employees? How does that work?
So the nurses, I believe, are employees, and the PAs. And I left out Tim Nicely, who's the physician overseeing the family, I guess. So we're all people known to the community, and also the flip side of that is we know most of the people in the jail.
Right.
And oftentimes we've known them. Well, they've kind of gone in and out of the jail, some of them multiple times, and we've known him oftentimes. I think one inmate I've known since he was 2 days old. So, so it's going to be a really radical change, and there are some good things about it and some bad things about it.
Well, and I'd like to get to that, because I had a conversation with the Del Norte County Administrative Officer, Neil Lopez, yesterday. And so, in essence, what he said to me was that there had only been 2 bids on the contract for providing medical services, Turtle Medicine and California Forensic Medical Group / WellPath. And the way he put it to me was that the Turtle Medicine response to the RFP did not meet what the county was asking for. And so the only choice they had, because they're legally mandated to provide these medical services, was to go with WellPath.
Right. So Turtle Medicine, Howard Croy was in the process of negotiating a contract with them to meet some of the concerns that they had. And it's not really concerns, it's more like needs, okay? So, and then all of a sudden, he feels like it was kind of pulled out from under him. And before he even went through the time period that he was allotted to respond to those concerns, all of a sudden, WellPath was in. So, Yeah, that's kind of interesting. I don't know what to make of that.
Yeah, no, that's very interesting, and that's I didn't have that information, so it wasn't something I was able to ask the county administrative officer about. But just to be clear,
right,
these 2 bids were requested by the county. WellPath made theirs. Turtle Medicine made theirs. Some concerns were expressed or something like that, and there was a process being gone through where Turtle Medicine was making an effort to ensure that those concerns wouldn't be a problem.
And they weren't really quality of care concerns. For example, they wanted an EMR, and right now the jail...
I don't know what an EMR is.
Oh, electronic medical records. Right now the jail medical records are on paper.
Oh, jeez.
Okay.
So Howard Cray was going through the process of trying to ensure that.
So it wasn't a question of quality of care. Were there any concerns that Turtle Medicine could not provide more hours of care to inmates? Because that was one of the things that Neil Lopez said to me. He said that basically there would be more hours of medical services available to the inmates in these facilities than Turtle Medicine was being able to provide.
Yeah, I don't think it's a question of whether they were able to provide it. I think that, again, that was in flux, that was in negotiation.
Okay.
And I think they were willing to make, those were the 2 main changes I knew about.
Okay.
And and I think they were willing to do that. They were actually in the process of hiring more staff, more medical staff.
So is WellPath distance medicine? Is that how it works, or would they also employ actual people here in the community?
So yes, to both of those options.
Okay.
As far as I know, the 2 RNs, and probably they've added some RNs or LVNs, probably RNs, would continue, and they're continuing in, I think, a more structured way. I don't really know how to say that accurately. Right now they're kind of always on call, and they're there certain hours. So that change that would be happening, which I think might be a good one, is that they're actually going to be there instead of kind of on call.
I'm sorry, I didn't mean to talk over you. So one of the things from another person who would have knowledge of these things that I was talking about is that actually, so let me see if I can phrase this correctly. Much of the job of medical personnel in the jail and the juvenile hall is, and I don't mean limited to, but generally dispensing medication, some types of first aid, sometimes people who have come into the facility who have gunshot wounds that have to be cared for and things like that. But that much of anything that's serious has happened, people are sent to the emergency room. That's kind of the standard procedure. Does that make sense?
Yeah, I guess I would agree with that. They're also, if they need specialty care too.
Right.
So one thing that Turtle Medicine has is connections to the community for dental care, for eye care, although that's changing, probably for orthopedic care, maybe ENT care. But yeah, they do utilize the ER. That's for sure. And
I guess the reason why I'm asking this is because at least my understanding is that, that's kind of standard operating procedure, when it comes to the medical service. So even if there were people physically at the jail, those people would still be sent to the ER. That wouldn't change just because there was somebody there.
So people are sent to the ER a lot. I won't say a lot. People are sent when there's a medical need, okay? Because there's resources at the ER that can't be provided on site. And this is a pretty bare bones operation too, I should say that.
Well then, so maybe this is a question that you may be able to answer or not able to answer. So as Paul helped me to understand, it's not $103 million. It's $1,300,000.
I'm just saying, there's a big difference there.
It's a big difference, yeah. Well, million here, million there.
It's a big difference, not to people like us,
right,
but,
right, yeah. So, that's double what Turtle Medicine.
Yeah.
So what does the jail and juvenile hall get that's going to cost twice as much?
Well, so they advertised for a physician. That's actually how Tim Nicely found out that his job there was ending, by that advertisement. But the physician, my understanding is, and this is evolving, okay, and I could be wrong, but my understanding, as it's been explained to me, is that's a telemed doc. And so one thing that happens when you have a telemed appointment is pretty much the exam part of an encounter with a healthcare provider is off the table, right? Maybe you could show the rash on your elbow or something, but for the most part, you can't listen to lungs, you can't listen to heart, oftentimes you can't get vitals. So that whole hands-on thing and they're going to rely heavily on the nurses who are really super good and super trained, and kind of have a good ongoing relationship with most of the inmates. But there's an important element that's going to drop out of the picture. That's one of the elements that I think will be a problem.
Well, is that going to materially affect the quality of care that people are getting?
In my opinion, yes. So I was talking with someone, and well, let me ask it this way. You were talking about how familiar everyone is, particularly with the inmates and all of that. Right.
Can that negatively affect the objectivity of the care? Cost-effective care.
Yeah, I imagine it can. It depends on what your familiarity is, whether it's kind of positive or negative.
Yeah, I guess where I'm going is that
it could anyway.
If you're trying to manage a budget and you have not personal relationships is the wrong way to say it, but long-standing interactions and all of that it can get easier to do too much or too little, depending on what those long-standing.
Yeah, that could happen.
Where a more objective person coming in might do something differently.
Right, that could happen anywhere. They can have a walk in any of the clinics. Yes, that is true. Hmm. But I also think that in my experience with physicians and other healthcare providers who are coming in from out of the area, let's say the doctor that they've hired, that teledoc, is in Sacramento or San Francisco or LA or something. Their idea of what a medically rich community, they kind of extrapolate that on into the local community, and I wouldn't describe us as medically rich.
Right, because they're coming from a completely different medical context and trying to apply that to what's happening here, and that is not the reality on the ground.
Right. So the other side of the familiarity is I can call the backdoor number or talk to the radiologist, say, do I need this or that? Would you, so I can coordinate care in a kind of more familial way. Mm-hmm. And I think that's important, actually. The other thing, too, is that in the case of probably a little bit me, but mostly Dustin Jaco, who works at Del Norte Community Health Center, he can actually say, he can talk to somebody that he's taking care of in the jail who is his patient also on the outside.
Right.
And he can call the receptionist, get an appointment for the guy when he gets out on Tuesday afternoon, so boom, he can be seen, Wednesday morning, and his care is pretty continuous.
Right. No, that makes sense. There can be a much better continuum of care. And let me just say, Dustin Jaco has been my primary healthcare provider at Open Door as well. I've been very happy with him. So, in general, I think the more local, the better. That's kind of my position on most things.
Right.
Then what, in your opinion, why why would the county go with something that costs twice as much that doesn't have the same local connection, and in fact will to some degree affect the jobs and income of people who live here, unless there's going to be some great improvement and increase in services.
I think actually that answer, as it's been explained to me, and you have more research on this, is concerned about malpractice suits. Now, Turtle Medicine has had 2 over 20 years. Because that's the other thing, they all know us, okay? And it's, there is some thought that if a provider is more, humble or has a better personal relationship with somebody, that malpractice is less likely to be on the table. But if somebody's kind of distant and not, doesn't, seems, maybe, attitude-y or something, that the malpractice thing would be more like a get back. And they, according to what we've been told, is that WellPath has deeper pockets.
WellPath is a $1.5 billion company located in Nashville, Tennessee. Right. It's actually, it in itself is owned by a private hedge fund. I think it's called HIG. I think that's what I remember. But and they've been consolidating medical care for incarcerated adults and juveniles all across the country and even in Australia. This is a big company that is really, seems to be really engaged and aggressive in taking over these jail contracts and all of that. And so 2 of the things that came up in the conversation I had with County Administrator Lopez was, one, the issue of lawsuits. Because just in the little research that I did, I found, published articles that WellPath one was, quote, dozens of federal lawsuits, unquote, and another one was over 1,300 lawsuits that WellPath has been facing. And I asked Mr. Lopez about this, and he was somewhat dismissive of that, in that, basically his premise was, well, there are a lot of frivolous lawsuits in this kind of industry and all of that, and so the fact that there may be a lot of lawsuits doesn't necessarily mean that the company is doing bad work. It just means that it's an industry fraught with lawsuits. And then he said something, and I didn't have a chance to ask him about it when he did, but the more I thought about it, when we were talking, he said the county's been very lucky when it comes to lawsuits of this type. And it made me think, well, okay, if jail medical services have been being provided for 20 years by some company and there's been virtually no lawsuits, well, then what's the whole premise about there's lots of frivolous lawsuits?
Yeah, why would you change up our luck in that regard?
Right, yeah. And I didn't have because I didn't really think about it when he said it to me, right? But yeah, if there hasn't been a lot of lawsuits, and I would think that means that for the most part the care has been deemed quality, even by the people who are getting it, who are supposedly the people who would be engaging in the frivolous lawsuits.
Right, and you could kind of argue that, sometimes people are sent to the ER for kind of rule out lawsuit. That the level of aggression, aggressive medicine goes up if the possibility of something really bad is kind of on the table.
So let me ask you this before I lose my train of thought on it. Okay, so if it's Turtle Medicine, let's just say. Turtle Medicine is in the jail, something happens, the decision is made that this person gets sent to the ER, right? Mm-hmm. Does that ER money come out of the contract that Turtle Medicine has, or does that result in a different kind of billing.
Yes, I think it's a different
extra.
kind of billing, and I think it likely goes to partnership or Medi-Cal. Yes,
Okay.
yes.
Okay. So okay.
So the financial, the decision to send somebody to the ER is at times financial, but not in the way, at least I've never made the decision in that way. I've made the decision to send somebody to the ER because there is a service that I think the patient needs that I don't have access to at that moment.
Right.
So, yes, sometimes people go and they're, and it, you know, as a result of them going, there's a billing change. And sometimes people are released earlier than anticipated, and that's a legal decision. That's not a medical decision.
Right.
But the part of what goes into making the legal decision is that they need medical care that's not available on a timetable that, you know, that could be accommodated if their release date was out there.
Or would be prohibitively expensive if it was done in the jail, if it could be done.
I don't think that's the main reason, but yeah, I imagine that. So an example of that could be somebody with a new diagnosis of hepatitis C who might need some initial staging labs that are expensive and then some treatment that's initiated. And oftentimes inmates are kind of in a position where they feel like they want to make better decisions because the judge is looking at them or because they have an internal aha moment or something. But see, if we took that person with a new diagnosis of hepatitis C and they were going to be released in 2 weeks anyway, and they're medically stable, then they could follow up with more resources at like the community clinic level.
Well, and I guess here's where I'm trying to get to, right? If the person is incarcerated, then whatever their medical treatment is the costs of that are going to have to be borne by someone.
Right.
Once they're released, the cost of that is basically on them.
By somebody else.
By somebody else.
It's usually Medi-Cal.
Right. And if you have a healthcare operation that is almost solely based on profit as compared to patient care,
right?
Those decisions seem to be they'll be made much easier. You know, it's like, hey, if you can get him out of here, get him out of here now before he costs us a bunch of money, right? Because I'm thinking of like private hedge funds don't get into these businesses because they're altruistic. They get into them because they make money. And the way they make money, and I said this to Administrator Lopez, is by denying care.
Well, I don't know because I've never worked for one of them. But I know with the group of people that are working for Turtle Medicine is, I don't think that's our main thing. We're not hedge fund operators. None of us are getting rich off of it.
Right.
But I think there are some benefits, actually, that supposedly WellPath is supposed to bring to the inmates. So that I see could be really good. So one is hepatitis C treatment. You have a moment where somebody is presumably not taking drugs and, you know, could be closely monitored and could be treated with, albeit expensive, medications. Or somebody, maybe a new diagnosis of HIV or Suboxone for somebody who has a opioid dependence. So currently Turtle Medicine doesn't offer Suboxone treatment. Okay, so now the whole prescribing thing, the logistics in prescribing Suboxone, I think Dustin's the only one that has the credentialing that's required, but that's been kind of in flux and changing, and I think it's possible I have it. I don't know. Kind of in process. So they're going to start providing those kind of services, and I think that's really good. So I think that's a small goodness in this.
Okay.
But I worry about the lack of exams. I worry about the lack of... Del Norte never does well when people out of the area come in and tell us what to do. The other thing that I haven't really touched on yet is as far as lack of resources. So they had an excellent psychiatrist at the jail, Katie Wilson, and WellPath kind of moved initially to get her on contract with her to get her ongoing services, but they made it so they put so many restrictions on her, and they took away so many resources from her, like psych techs and things like that, that she said, I don't need this. And the same happened with the dentist. Is that they put so many restrictions. They tried to work with local people, but it was on their terms, and their terms weren't really compatible with those people's way of managing their career.
Well, I asked Neil Lopez about the possibility of local people not wanting to work with CFMG. He said he wasn't specifically aware of that, but he had heard rumblings, I think was the word that he used.
Yeah.
So I'm trying to think how to word this without being too complicated. So if an out-of-area company is going to put in, and I'll use this word, kind of onerous restrictions on these healthcare professionals, and these healthcare professionals say they don't want to work with this company, with the small field of doctors and other professional healthcare folks that we have, what happens then? I mean, are they going to have to ship their own people in? Or?
That's my point. When you're the medical director and you're sitting in LA, it's inconceivable that there could be a place in the world that doesn't have a dentist.
Right.
Right. Yeah. Right.
Or it's inconceivable that you couldn't get some kind of specialized X-ray technology. It's interesting when you even refer people to Medford, and they refuse to see people from Del Norte County until they get some specific set of testing that's just not available here, but is easily available in Medford.
Right.
And I think there's going to be a steep learning curve for these guys.
So because they don't really know what they're getting into here.
Not yet. And they also don't. The other thing, too, is transporting people, because maybe let's say they have an inmate who needs something special, like an eye issue, and their Pacific Vision is closing at the end of the year. So that, as far as I understand, there's no ophthalmology practice after that. So how do you get an inmate? Can you take him into Oregon? He's not supposed to leave the county. Can you take him down to another county jail facility? And who transports the guard? They have kind of not a lot of extra guards standing around to do stuff like transports and things. Logistically, I think they're gonna be blown out of the water.
So let me ask this. So one of the cases that I saw related to WellPath is that a person who had mental health issues was prescribed a specific kind of medication. And so the alleged problem was that this medication had some kind of stimulating effects to it, right? And so while it was a legitimate prescription that had been prescribed, WellPath refused to give the prescription to the patient, in essence saying, well, they're in jail. It's not like they're going to work or doing these other kinds of things. And so being stimulated in jail, might be a problem, right? And so it almost seemed to me that the decision was being less made on the needs of the patient and more on the security concerns of the facility. Does that make sense?
It also doesn't surprise me. Yeah.
Why doesn't it surprise you?
Well, I would say in my time with internal medicine, we don't prescribe opioids. We barely prescribe opioids outside of the jail situations. So in the community clinics, there's been a huge decrease in the amount of prescribing. It's in kind of a more honest respect for how opioids can destroy lives. Mm-hmm. So and WellPath says that they're going to prescribe opioids in the jail. Now the guards are not super happy about that because that automatically, I don't know how to explain it, but when you give somebody a prescription, most people would say, okay, the doctor says I have to take this, I'm going to take this. They don't necessarily do that. It becomes part of especially if it has some value to it in some way, it becomes part of an underground currency.
Yeah, like a contraband thing.
Right. And boy, opioids are going to be they're going to be the really top of the line there.
Well, let me ask this then. Have you ever experienced, or has anybody you know ever experienced any pressure related to medical decisions and or treatment? What I mean pressure from the facility because they thought it would cause them problems and it would be better if whatever this thing.
Yes.
That's
super. Like I sent somebody to the ER with chest pain who had a cardiac history, and there's a protocol about the vitals are out of range a certain amount, then do this or do this, and she was like, she had to go to the ER, and there was a problem because there was no guard to take her. So yeah, that happens. And then they kind of, I don't think she got a delay in care, and I don't think they called an ambulance, but they had to reshuffle people, and they were a little disgruntled.
Well, I know there were other stories about particularly pregnant women who, were not getting appropriate care related
Is that
to
with WellPath?
Yeah.
Yeah, I'm trying to think of last time I saw a pregnant woman in the jail.
So I guess kind of like finally for me here, how does the medical care that's being provided by a contract service like WellPath or Turtle Medicine, how does that get evaluated? Because that was one of the questions that I asked Neil Lopez.
That's a super good question. I don't have any idea with WellPath, but I think I think from the PA viewpoint and PA working with MD viewpoint is that there's certain protocols kind of embedded in texts and medical resources, like Up to Date is a common one that's used. Dustin's got it on, we've all got it on our phones. And so our agreement with the physician that we work with, which is Tim Nicely, is that we're going to use these protocols and these resources. And so he reviews every single chart. So even ones that are, I don't know, kind of mundane, like Athlete's Foot or something, to ones that are really complex, like trying to take care of somebody after perhaps an assault, because they tend to beat each other up sometimes, or somebody that's got a complex drug withdrawal, alcoholic, maybe coming off booze and maybe has DTs
or benzodiazepines,
or there's all kinds of ones that are really complex. So and we're all connected, so we have really easy pathways to I can call Tim up and say, what do you think, this or that, or something else I haven't thought of. And we're all experienced PAs, and we all know how to access answers to questions. So for the most part, and we've all kind of worked with Tim for a long time, so for the most part there's no big mysteries. And we have meetings and we talk about cases and stuff like that.
Well, the reason why I asked that question is because I asked this of Administrator Lopez, is that, okay, we have this big company, all of the pressures that go with having a big company owned by a hedge fund, with a track record of a lot of lawsuits, right? So how does the county go about ensuring that the quality of medical care for our incarcerated adults and youth, meets the appropriate standards, right? And in essence, the answer I got was, well, you have like the jail commander and the juvenile hall commander and the Department of Social Services, and that they will be the ones who will be ensuring that this health care is delivered appropriately. And in the end, the buck stops at the CAO's desk, and if they don't fulfill their contract, they won't get another contract.
So that's an administrative answer to a medical question, in my opinion. None of those people have any idea. Like, I recently had a conflict in juvie, which we don't really need to get into, but I was being told how to practice medicine by one of the guards there, and they clearly were coming from a political viewpoint and not a medical viewpoint. So yeah, those people have, I'm kind of flummoxed to think that they would be able to evaluate any of this.
So in the end, really what's going to happen is like CFMG and WellPath are going to evaluate their own performance and basically give a report, right? Unless something grossly inappropriate happens.
Right. And I have no specific knowledge of them, but I imagine that it would be similar to like what happens maybe at the community clinic level, that there's a lot of peer review. And there's a lot of protocols in place, and they really do stick to them. For example, at UHS, my medical practice is evaluated by my peers, which is not only providers here in Del Norte, but providers in Humboldt County, pretty much quarterly and very thoroughly. And it's, we don't take anything personally because there's no point in that. But we definitely are committed to doing it better, making it better. I don't know, sometimes that means more money, and sometimes I don't know really what they do in WellPath,
So
finally, because we're very short on time,
okay.
We're the opposite of short on time, actually.
Oh.
We're over.
We're way over.
Yeah,
we're way over. Oh, I'm sorry. I'm sorry.
These are really good questions.
Well, but I'm taking too long with them.
It's just that it'll have to be a half an hour on Sunday, too. And if it's not a half an hour on Sunday, it screws up all of Sunday. It's just things like that I'm sitting here. But you're absolutely right. And I just want to also chime in, as far as I could tell, I think we should hold off the rest of this Health Matters for next time.
Okay.
But my best reading of the comments on Facebook is that the county has approved the contract with WellPath.
Right. Yeah. That was almost a given from what I had heard.
Yeah, they had already come in this week and started taking over.
Yeah.
Gotcha. Wow. Okay, that's interesting.
Yeah, they ruffled people's feathers.
So I guess. Then finally, what's the most important thing that the people of this community need to be doing to pay attention to ensure, as best as possible, that we can, that these services are being provided appropriately, and and that there's watchful eyes on what's happening.
Yeah, totally. I think what's going to happen is there's going to be a lot of initial good things, but stay critical for a longer period of time, because I think it sounds great to have addicts on Suboxone, or people with newly diagnosed hepatitis C being treated, or people having access to specialists and gee whiz on the telephone, on the telemed thing. But remember, they're not going to be able to sustain that goodwill. And I think it's going to be obvious that things will start to fall by the wayside because they don't have the resources. They really don't, that they think they do.
The locally based resources.
Right. But the same, internal medicine people aren't going to disappear. We're still taking care of your community, and we could still reach out and be helpful.
Okay. Lynn Szabo, thank you very much.
Thank you, Lynn. Mm-hmm. And that does it for this week's Health Matters. We'll be back and I guess we'll do the monoclonal
antibodies. Yeah.
Yeah, that's a thing. I posted that on Facebook as well. So actual treatment for people who are suffering from COVID.
For mild to moderate.
Right on.
Yeah,
right on.
So that's good.
Well, thank you very much. That was very informative and getting deep into that. And again, this is a big change that most of us in Del Norte won't even be aware of. But there could be some real consequences from that. Thank you, Lynn.
I hope it turns out to be a good thing.
Yeah. Sounds like in some ways it might, and in a lot of ways there's a lot of things to watch.
Yeah.
All right, Lynn Szabo, Health Matters. Thank you so very much. We'll catch you next week, and it's good to have you back in the studio. I'm glad you don't have COVID.
No, and I had my third shot.
All right. Look at that. Okay. Well, things to discuss moving forward. Lynn Szabo and Health Matters, only here on KFUG.